My name is Heather Schwank, and I'm going to demonstrate how to perform a thorax and lung assessment on an adult patient. I like to look at my assessment as a three-phase process. The first phase being the introduction and observation phase. The second phase being the actual physical assessment, where I'll palpate, percuss, and auscultate the lung fields. The third phase is just a wrap-up phase with some question and answers and education if necessary. So we're going to get started. Hello, my name is Heather, and I am the registered nurse, and I'm going to be performing a thorax and lung assessment on you today. Do you have any questions for me?
No, not right now.
Can you tell me a little bit about your past medical history? Do you have any heart problems or respiratory issues?
No.
What's brought you in today?
A little nasal drip and coughing.
Do you get that on a chronic basis or?
Every season.
Okay. Maybe some allergies. Do you have any allergies? Any smoking?
No.
Okay. During this time while I'm asking these questions, I'm also going to be visually inspecting the thorax area on the anterior and the posterior side. What I'll be looking for is any kind of deformities, scars, any kind of discoloration in the skin, paying close attention to the lips and the nail beds. They should be pink in color. Any blue or gray or ashen color is going to be an indication of a respiratory issue. There should be no clubbing on the fingertips. That's an indication of possible COPD or emphysema. I'm also going to be observing her respiration rate, rhythm, effort, and depth. Is she even and unlabored, or is she working to breathe? I'll be looking for accessory muscles, using the accessory muscles, pursed lip breathing. I can also look to see if she has some symmetrical breathing. I would place my hands right around the 9th rib area and ask her to take a deep breath in through the mouth and out through the mouth. In my arm, I would watch my hands raise, making sure they're coming back to the starting point. If there's any asymmetrical breathing, that means there's some kind of a problem on the side, not enough inflation or deflation, not enough air going in or out. Now we're going to move into the second phase, which is the physical phase. And on this phase, I'm going to palpate, percuss, and auscultate. First, I'm going to palpate. During palpation, I'll do the posterior and the anterior, and I'll move in a side-to-side motion so I can compare both sides evenly. What I'm looking for here is any kind of masses or deformities. I'm also looking for some crepitus. Crepitus is air trapped underneath the subcutaneous area. It sounds like bubble wrap up under the skin, like a crackling. I can also look for, listen for tactile vocal firmitus, which is vibration within the chest wall. This should be even on both sides. If there's an increase or decrease on either side, that indicates there is a problem like pneumonia or something like that. And what I'm going to do is just place the palmar side of my hand in the intercostal areas between the ribs and ask the patient to repeat the phase 99.
99. 99.
And again, you're going to work in a side-to-side motion so you can check each side evenly.
99. 99. 99.
And again, we'll do the posterior and anterior side.
99. 99. 99. 99. 99. 99. 99. 99.
Now I'm going to percuss. With percussion, you'll also do the anterior and the posterior side. I'll take my non-dominant hand And I'll place my middle finger again in the intercostal space between the ribs. And I'm going to take my dominant hand and use my middle finger and do a quick tapping motion on my finger. There are 5 sounds that you can hear with percussion. Resonance is a normal, hollow, low-pitched sound over the lung fields. Hyperresonance is even lower pitched and it's very loud and booming. That's an abnormal sound on the lung fields. Tympanic sounds are like a drum-like sound. And dullness, it's like a thud sound. Those are both abnormal sounds. The dullness could indicate a tumor or pleural effusion. Now I'm going to go and auscultate, and again I'm going to do the anterior posterior side, moving from a side to side pattern. What I'm listening for here are normal breath sounds and abnormal breath sounds. Normal breath sounds are bronchial sounds, which are normally heard within the tracheal area in the mainstream bronchi. Bronchial vesicular sounds are heard on the branching bronchial, and vesicular sounds are heard in the peripheral areas of the lung fields, and they're more of a silent rustling sound. We're also listening for abnormal breath sounds like crackles, which sound like fingers fingers running across your hair being rubbed between your fingers. Wheezes, which are musical tones. Stridor, which are intense, continuous, monophonic wheezes. And again, I'm going to move from a side-to-side motion, asking the patient to breathe in through her mouth and out through her mouth as I touch her. Deep breaths for me. If you do hear abnormal breath sounds, it's good to ask the patient to talk and see if they clear, and then listen to the area again. Do you have any questions for me?
Not right now.
Okay. Thank you. That concludes our video. I hope you enjoyed it.